Okay. One question that has been asked here is, does candida happen only in women and children? No, I actually said adults. I didn't say women. It happens in men as well. In women, we just have that added place that candida is a nuisance, and that is in the genital tract. But I'm sure even in men, it is quite a nuisance as well. And remember, we talk about it in terms of overgrowth, when it has overgrown. Okay. Carol, I'm not sure whether this is a comment that I should read out, that it is very sick. I don't know. I try to simplify it as much as possible, but that's why I have invited you to ask questions. What is homeostatic imbalance? Homeostasis is actually balance. So when something is out of balance, then it is out of homeostasis. Right. I'm going to unmute you. You're welcome to ask a question. Victoria,
Hello, Dr. Eseza.
hi.
Hi. I just started the detox and I was
Yeah.
hoping you could, like, after your presentation, it definitely makes a lot of sense with the detox because day one, day two, I had the neolax and everything is just coming out. And I'm like, okay, I didn't know all of this is within me. At what point can I start incorporating either other supplements or can I start doing my shake again? Like, if you could just give us some more insight into the things that can supplement the 3-day detox, I think that would be great.
Awesome. Okay. Victoria, I know for a fact you are zooming in from the United States, and thank you for your question. Right. As your detox in America comes, it comes in a 3-day detox, pre-packed, very easy to follow. So days one and two are what we call the cleanse part of the detox, where you do three beta guard, stage six or neolax in the morning and in the evening, and a garlic morning and evening. Then you repeat that the following day. So day one and day two. Day three, you can bring back the shake. You can bring back other supplements. If you stopped the omega and the threonine, I generally say carry on with omega and threonine because during the cleanse phase, they might be a bit of an inflammatory reaction as you're cleansing. But if you stopped that as well, then on day three, you can bring them back. And then there's acidophilus that is introduced. That is the probiotic which you have. We will import it from you. Um, Once you use the probiotic, it is generally to repopulate all those um, good bacteria in the hope that they will overcome the bad bugs, including candida. Now, you will have to repeat that cycle. So you set up your own cycle of how frequently you want to do it. Some people are so full of toxins and have a need to detoxify regularly that some opt to do it every month. Take 3 days out of a month and just repeat it until later on, let's say 6 months down the line, they have achieved a goal. Weight loss. It might be to stop getting allergies or hectic allergies. It might be to stop being brain fogged all the time, right? So this is really an individualized schedule because we are all different. But on day three, you bring back your or your chicken, your shake, you continue with the vegetables, but please, once you have experienced eliminating heavy starches and breads and all those heavily starchy foods that feed the candida, you won't want to go back to them the way you did. Now, if you notice, the modern thinking about weight loss is remove all carbs. Right? Have you heard people say that? Stop carbs. Just stop carbs and you'll be all right. I think they forget to give the proviso or to tell us exactly why the thing what the thinking is behind that stop the carbs. But essentially to stop feeding the candida that is causing the cravings. But you need to pace yourself, and that's where the detox comes in. It's very valuable, and you'll give us a report next time, Victoria. I think we discussed this, and welcome. Right, great. Um, uh, Carol Banks learned that candida resides in the gut of a baby after birth and continues till adulthood, and it continues and it continues. But Carol, one thing I did emphasize is that candida on its own, in our guts, where it is right now, all of us on this have a bit of candida in our gut. The challenge is overgrowth, and that is always a challenge. And overgrowth is promoted by our lifestyles. I hope that is a lot of food for thought. And anybody has any comments on the auto-brewery syndrome? I'm curious to hear what you think about that. Okay, somebody would like to know. Ooh, actually, I should make somebody a co-host. May I do that? Um, I've got my very good co-host here, all the way from West Africa. May I ask you to assist me with reading these things in case I miss them out, and thank you.
All
So,
right, I will, but I'll be getting off the call top of the hour, but I can read.
okay,
Thank you.
we will have finished. We only have 10 minutes to the top of the hour. That's why I wanted to speed it up.
Okay.
Um, Please, what was the
Okay.
natural probiotic that you mentioned? Let me just start at this one. What was the natural probiotic that you mentioned? I mentioned sauerkraut that I make out of cabbage. I think we'll discuss that next time that we talk again. But yeah, cabbage is amazing at creating a probiotic. You just need two ingredients: cabbage, chopped up. I mix white and purple cabbage and salt. I use Himalayan salt. You can use sea salt. You put them together in an airtight container, but make sure that it has time to breathe because a lot of gas is produced by the probiotics. And there you have it. Within 3 days, you have your probiotic. So since sauerkraut, since I learned how to use sauerkraut, when they removed acidophilus from our market, I've just carried on with that. Okay. And if there's any interesting
Yeah, the
question.
next question is, how often can this detoxification be done?
Okay. I think I mentioned it. Some people may need to detoxify monthly. Other people might say every 3 months. Other people are not too bad and they say once in 6 months is enough. In the old days, we used to detoxify for 1 full month of eating fruits and vegetables and avoiding flour products and avoiding rice and avoiding meat and all that for a full month until it became a bit hectic for people. And maybe the company saw that it was not very productive. So they've reduced it to a 3-day detox of an intensive detoxification, but then you bring back the food so that the gut bacteria are happy to continue with their work as long as you don't overdo the starches. Okay,
Right.
what else?
Which products do we give a child with infections below 4 years? And someone replied, sauerkraut.
Okay, that is somebody said sauerkraut. Okay, a child below 4 years, the ideal thing is to watch their diet. a lot of us have been enticed into going commercial with our babies and using too many sugars, too many highly processed foods, processed foods. Even the milk has antibiotic residues, unfortunately. So we may need all to introspect and say, how can we go back to the basics? Because look, commercially produced foods, all the corn flakes and the quick breakfasts are not useful to the baby, and they just establish and promote the candida that we've talked about today.
Okay. Someone said, I'm one of the people taking Nexium to suppress acid because the doctor said I produce a lot of acid. At first, yes, I thought it was ulcers. Okay, that's a comment. Is a combination of any two products effective?
You mean Neolife products?
Probably. That's Theo.
Okay.
Maybe Theo can elaborate on
If you put
her
your hand up.
question.
But basically, that is one of the myths, one of the medical myths, if I can call it that, one of the errors that we have promoted of saying that, oh, okay, you are feeling this pain and it feels acidic or acid, let us stop the acid. Because the minute you stop stomach acid production, you are opening up the rest of the gut to becoming colonized by disease-causing organisms. Why? Because the stomach naturally is supposed to have an acid level that is very, very high. In other words, the pH is low. It's between 1 and 3. Okay? The stomach is supposed to be very acidic. But if we are giving drugs to stop acid production, I have personally seen a patient who I was telling somebody this story just earlier today, that this patient, I saw her because she had sustained fractures, many fractures in her, including in her toes. So I got down to my usual habit of connecting the dots. I asked her a few questions. What medications are you on? All right. So she pulled them out, and among them was the very one that has been mentioned, the person asking this question. And it is that inhibitor of acid. It inhibits acid production. And I said, for how long have you been on this medication? Well, my doctor said I had to stay on it for life or for a very long time. And so far, up to that point, she had been on it for 2 years. Okay. And I said that is wrong, because if you read carefully, the packet insert, some people actually remove them so that nobody reads them, says that you shouldn't go chronically on that medication. It is to be used for a short time, and then you stop that medication. But here she was inhibiting absorption of calcium, magnesium, zinc, all those minerals cannot be absorbed for as long as acid in the stomach is not being produced. And she had the results to show. She fractured her femur and a few other bones. And then she was confused. Why am I breaking? But that's why she was breaking. So, yeah. Okay, carry on.
Is candida the cause of some blockages in the intestines?
It could be. It very well could be, especially if there is fecal impaction. That simply means if stool gets stuck. And if there are other worms as well, other parasites, which they very well could be. Everybody alive and walking has a few parasites. And then if there's scar tissue formation, that can cause a blockage. And obviously, if for some very unfortunate reason, there is a tumor that develops, that can cause blockage as well. I think
Okay.
if then, are there
Is
still
there
many
more?
questions?
Yes. Let me ask
Fine.
one more, I think.
Mm.
What supplements can you recommend for a patient who is scheduled for dialysis?
Okay, that is a question that is often asked. Have they actually started dialysis? I'm just curious to know.
Not
I
yet,
would,
but
not
the
yet.
doctor says so. Mm.
Mm. Okay, I have very, very recently advised a friend of mine who was on dialysis to do a detox. And obviously we had started that friend of um, on vitamin B complex because of the need for energy throughout the body, including within the kidney that is failing. We had suggested, obviously, CoQ10, again, for the same reason, the need for energy. Threonine goes without saying, omega-3 goes without saying, and carotenoid go without saying. So we are looking at the Pro Vitality if you have it in its entirety. Otherwise, if you just have those ones and can get CoQ10. And then I said to them that even though there is the belief that anybody who has kidney issues should not use protein, I think that is not the total truth because we do need some protein. So I said, rather than using, for example, 2 scoops of shake, just use one. If you can't do it every day, do it every other day. But give yourself, for the simple reason that protein, apart from being structural, being very nutritious, is also required in the transportation of nutrients around our body. And its absence will cause a lot of what you want transported and incorporated and assimilated not to uh, happen. That doesn't happen. So yeah, the core nutrition, as I showed it at the beginning, is for everybody, regardless of the condition. And if we can just get that sorted out in our minds, I think we would all be much, much healthier and much happier. So, Anne, I think let us stop. I like to respect time. And for all the guests that are here, if you are new to this presentation and you've been invited by a friend, please turn to them and say you want to know more, and better still, you want to be part of the family. We are a family on a mission, a big mission to make the world healthier and happier. And you can choose the price that you want to buy it at. We generally encourage you to buy it at the best price, but not everybody takes us up on that offer and they prefer to buy as customers. That is also good. So turn to the person who's invited you and say you would like to get some of the products, if only for your own health. But I promise you, you will want to be part of the family. And so next week, I would like to hear who would like to do a presentation, and I would welcome that very much because next week is the week when we have opportunity presentation, and we also hear some very, very good stories. So until next week, thank you, Anne, and thank you for all of you for your questions. We shall chat again next week. God bless you.